Good afternoon. It's a beautiful day. We're happy to have a president gave, I think, a great speech last night. He said that America is on the move. And I liked hearing that because Washington is on the move as well. We've got a vaccine. We're getting people vaccinated. We've got some new policies nationally that really are very consistent with what our legislature just got done with the tremendous achievement last week. So it's a good day. Another reason it's a good day is that I'm proud to announce that Cheryl Strange will be our new secretary for our Department of Corrections. She's already part of my cabinet. She currently heads DSHS. She is a very well-respected leader, both seasoned and a person who knows how to bring innovation in a very progressive way to organizations. I didn't have to look far for our new leader. I'm pleased that she stepped up to the plate because she has had lots of experience as well as a willingness to work with people to move organizations forward. My direction to Cheryl is to continue our work to improve the medical care delivery system in our Department of Corrections, to continue our reform efforts that we have good momentum on, and to continue to support the education and career training and chemical addiction programs. Fundamentally, on the goal is to prevent people from coming back into the system. We want to continue our efforts so that people are prepared for life after they're in custody so they do not come back into the system. We've made some good progress to start that. I'm confident she can continue to accelerate the pace of those efforts. Her work, I think, has prepared her perfectly in 40 years in government, nonprofit, and labor organizations. I'm particularly pleased that she has had experience with the Pioneer Human Services Group that worked on important issues of reentry and work release and behavioral health. We know those things are all connected. Prior to that, she served as CEO of Western State Hospital and with the Health Benefits Trust of SEIU 775. Rarely would we find a person with such experience that touches both her current previous work with Department of Corrections. She feels that she's coming home in some sense with vast experience in healthcare that's so important in our efforts. I want to thank Steve Sinclair for his career at DOC, I believe 32 years, and the reform efforts that he began in the Department of Corrections. With that, I'd like some comments from our new DOC Secretary, Cheryl Strange. Cheryl.
Thank you, Governor. I appreciate the opportunity to serve with you again, and I'm really looking forward to returning to the Department of Corrections. If you don't mind, sir, I'd like to just do a quick shout out to the 8,800 Department of Corrections staff working hard every day to create safe communities, both inside and outside of the prison walls. Next week is National Corrections Officer Appreciation Week. So I would just like to first start with a shout out to them. We've definitely come a long way in corrections in this state, and we obviously have a very long way to go as well. The whole central theme of really continuing the progress and the preparation to return people who have been incarcerated home. And to stay home. And that is what you've asked me to do, and that is what we will focus on. Coming from DSHS and a background in human-centered work, I'm eager to get over to the Department of Corrections and begin picking up where Secretary Sinclair and that team have moved so far. As you know, there are things we are all concerned with. Health service delivery is top on the list, and you've made that very clear. And I spoke with the ombuds this morning, and there's work to be done there, but I am confident that we can get to the root cause of that work and come up with solutions that sustain that work. We're not out of the woods yet with COVID. And, we have work to do and to keep moving forward with that, with our vaccination program there, our other protocols, and just a shout out to the Department of Health and Dr. Shaw and Lacey and team for helping us here in DSHS, as well as the work they've done at the Department of Corrections. The commitment to reentry, to housing. It's a job, it's housing, and it's treatment. And those three things together can make for a safe return home and to stay home for our incarcerated folks. And I'm looking forward to the work. So thanks for putting your trust in me, and I look forward to doing it.
Thank you, Cheryl, for stepping up to the plate here. And when Cheryl says stay home, that means don't come back. Don't come back to the Department of Corrections. We want you to have a life outside of our system. And we know that we can be aggressive in moving in that direction because we want to reduce recidivism. The goal here is to reduce crime, and I think Cheryl's going to do a great job in that regard. With that, if people had any questions of Cheryl, we thought we'd pause now before we continue our discussion. Any questions of Cheryl?
I think we've got one so far from Jim Garner with the Seattle Times. Go ahead, Jim.
Hi, thanks for taking my question. I have a question for Cheryl and also one that's more directed at the governor. I guess I'm wondering, new secretary, DOC has been mentioned, has been heavily criticized and been under a lot of scrutiny for breakdowns and failures in healthcare, including really terrible failures with people who have cancer, has led to suffering deaths and lawsuits. Can you speak a little more to see where you see DOC going in that direction and what confidence you have that that can be turned around? And then for the governor, I'll just throw in the Secretary Sinclair's announcement of his retirement came not long after the correction ombuds delivered a pretty scathing report to your office about some of these cancer failures. I wanted to ask whether you requested Steve Sinclair's resignation or retirement.
Go ahead, Cheryl.
Thank you. Jim, I don't want to speculate too much on the root cause behind what is going on in health services in the Department of Corrections. I know that there are very dedicated people working in that. I am aware that there is a plan. There has been an appointment relatively recently of a new medical director and a new assistant secretary of health. I'm looking forward to working with them. I need to understand what the root cause is. And I will hold off on speculating about what that is. It is imperative for people who are incarcerated to have access to timely, effective health care. And so I will leave it at that at the moment, and we'll have more to say about that after I've read the health plan that they have, remedy plan that they've put forward, and have a chance to look at that and work with some outside parties on some of the quality review of the program. So looking forward to that.
Jim, I will not give you a direct answer to your question because it's irrelevant at this point. What I will tell you is that I am very committed to having appropriate medical care for the people in the Department of Corrections. These people deserve it, they're going to get it, and we're going to make sure that that's the case. And I think we do recognize that there needs to be work done in that regard. I do want to thank Steve for a career at the Department of Corrections. He has quite a bit of things that did improve under his watch, including sustainability efforts and some of his reentry work of giving more vocational efforts or training to incarcerated individuals so they don't have to come back. I think we're appreciated. So that's what I'm going to say on this. Okay, Cheryl, thank you very much. I know you're going to get back to work. And
Thank you, sir.
Thanks for doing that.
We'll see you. Thank you so much.
Thank you. I'd like to acknowledge the situation at Hanford. We were informed today that there is a leak that has now been identified of one of the tanks. My staff in the Department of Ecology have been briefed on this. They're monitoring the situation closely. Obviously, this is a concern. It has been a long-time concern of ours because there have been previous thousands of gallons of waste. I'm advised this is about 1,300 gallons that has been identified in this particular leak. I am advised from the information from the federal government that we see no reason to believe there is any imminent threat of health to Washingtonians. That's good news. But this incident, this recognition of an ongoing incident, I think highlights the need for additional resources at Hanford to prevent further tank leakage. As you know, our state's position has been that the usage of double-walled tanks ought to be a solution in the interim before permanent storage solutions are found. I think that this leak continues or bolsters our state's position in this regard, because these should not be acceptable to the state of Washington. And we will continue to monitor this. Our Department of Ecology obviously has some permitting authority in this regard. And as the situation develops, we'll keep everybody appraised. We have Dr. Shaw and Lacey Fehrenbach on hand for questions, but let me turn to our situation regarding COVID. This has been a difficult year for all of us, but it is a moment where we have a new, incredibly effective weapon against COVID, and that's our vaccine. And I'm glad people are getting vaccinated. We're over hundreds of thousands of people now. That effort is continuing. But I do want to talk to you about the nature of the threat that we face today. We have simultaneously a new weapon in the fight against this pandemic, namely this incredibly safe and effective vaccine. But simultaneously, we have effectively a new threat, a more powerful and dangerous threat. And that's what I think we could call COVID 2.0. This is not your grandmother's COVID. This is a new form of COVID, a mutant strain that today has caused a fourth wave, a fourth surge that we are in the middle of that is threatening the health of Washingtonians. I want to share with you the extent of the risk we face. I want to show you a graph. The graph basically shows over time the waves that we have suffered. To the far right is the wave we are currently at. You'll see a relatively sharp increase over the last 2 months. We had a precipitous decline, which we were very happy from December and January, and we went down, but now we are heading back up relatively rapidly, unfortunately. And these are very disturbing because we know that hospitalizations have also gone up. Now, this graph, if I can ask you to focus on it just for a moment, one could at the moment say, well, we're shorter at a lesser rate than we were during the height of the third surge in December and January. But this is no cause for confidence because this is heading up. And according to our Institute for Disease Modeling, it will continue to head up unless something changes. So we are up against a fourth surge that is very dangerous, that has the capacity to overwhelm our hospitals as these numbers continue to rise. And at the moment, the thing that has the capability of breaking this rise is increasing vaccination rates, which I'll talk about a little bit later. Now, why, if I can take that graph down for a moment, I'd like to now explain why we are in this pickle. Why are we facing a fourth surge after all of our efforts, all of our joint efforts of masking and being responsible? And I want to thank Washingtonians for doing that by the millions. Well, the reason is there is a series of new variants of mutant strains that are much more transmittable, particularly one of them, than the original strain of the virus. And that means that every person who is infected now is much more dangerous of infecting other people around them. And there is considerable evidence that these variants also are more dangerous, particularly to younger people potentially, to have more severe illness. So I want to show you a graph now. It's going to be a moving pie chart. We're going to look at it several times so that people can focus on what it is. what we'll show you here, let's just take it back to the beginning so I can orient people before you start it. We're gonna coordinate our graphs here. We're gonna take the graph back. We're just gonna put it up there and let people look at the.
It's going to go automatically.
It's gonna go automatically. Well, that's difficult. Okay, well, we're now showing you a graph, and this will show you the respective percentages of the total types or varieties of COVID we have. This is really an important graph because it demonstrates what we're up against. In a minute, I'm going to start this moving graph. When you see it, you'll see a circle with all blue, and that all blue is essentially representing the original strain of the variant. Then we will see, as the sweep goes around the graph, you'll show the changes in the variants that will come on. First, you'll see a gray come on. That represents a variant called 29.7. Then you will see a increasing color of orange. And that represents, of course, I don't have the graph here in front of me, 117 as I recall. You'll then see green, which represents a third variety. And as the sweep goes across, you'll see the progression of these varieties. And when we finish the graph, you'll see where we are today, with the most transmittable variant being the dominant variant at the moment, and unfortunately increasing quite rapidly. So when I say go, we'll start and we'll watch these variants. Why don't you take it away? You see the gray coming on. Now we have the 117 variety continuing to sweep, and now the green in a substantial portion. Please note that the original variety is only a small sliver. So over 85 or 90% of the varieties that are dominant today are not the original strain. These are all COVID, what you might call COVID 2.0. Let's watch it again. We'll set it up again, and let's just watch the varieties again. Go ahead. The gray's coming on. Now we have the 117 orange coming on fast, and then now we are with orange. The 117 is still the dominant variant and increasing quite rapidly. I'm going to watch it one more time because I know this is a lot of information for folks to get. Here's one variety. Now we get the second variety taken over, and we end up with three varieties, including the green. So the point I want to make is there is a significant reason for this fourth surge, and it is we simply cannot ignore. This is a fact, it is a scientific principle, and we cannot ignore it. Because if we ignore it, it will sweep right over the top of us. Our hospitals will become jammed. Our ICU units will become strained. We will lose the ability in hospitals to get elective surgery. We will not have the ability to get common, ordinary care if our hospitals become overwhelmed. And we are heading in that direction. Thankfully, we're not there yet. But that's the direction we are going. So what do we do about this? Well, we have good news. We have masks available to us to continue to use indoors with non-vaccinated people. But we also have a vaccine. And I mention the vaccine because for those who don't like masks, there is a really powerful weapon to, over time, get rid of them. And that's to get a vaccine, and we have that available to us. And it may save your life, it may save your spouses, it may save your grandparents. And we've looked at the numbers, and it's really simple. The way out of this pandemic is to get vaccines. And we're very appreciative of the hundreds of thousands of Washingtonians who have already got vaccines and continue to do so. So the situation is, I'm not asking people to listen to the governor, I'm asking them to listen to the facts here. And the facts are is if we don't want our hospitals to be overrun, we need to continue to do what we know works, and that's to get ourselves vaccinated. And I know there's some people that have some reluctance in that regard. I'm hoping that their relatives and people who love them can talk to them and remind them about that this is a potentially life-saving treatment. particularly for young people, because now we're having just under half of our hospitalizations are people under the age of 50. And we're finding young people have long-term chronic problems associated with this disease, even if it doesn't take their life. But if you do have a relative who has some hesitancy about this, and they might have been upset that there was mask wearing that they were not comfortable with, this is a way to get rid of them. This is a way out of Dodge. This is a way to have more liberty in our lives, which is to become vaccinated and rely on the vaccination to drive this pandemic down, which we know it can if we will continue this effort. Now, not everyone has been participating in this effort. I heard about a bunch of people over in Ferry County decided to have a series of social events, in part to show that COVID didn't matter. They wanted to show that COVID is no big deal. That was at the Eagles Club, I'm told, over in Republic. They flouted public health guidelines, they ignored clear science, and it ended up turning into a super spreader event. As a result, there was an outbreak. And today there have been more than 80 people infected in Ferry County. It's taken a tremendous toll on the community, on their healthcare system, and on businesses. We all have a stake in getting vaccinated and continuing to be careful in how we live our lives. And we've seen that in Ferry County. We don't want to see that in other places. So I want to ask a question. Actually, a friend posed it to me the other day. You know, if we have vaccines and some people just aren't willing to get them, why not just give up on this effort? Because after all, it's their lives in some sense. Because then they would just be taking a risk. We can't do that for several reasons. First, not everyone has got vaccinated yet, had a chance. We've now just opened it up to everyone for a week or two. We need to give everybody a chance to get the vaccine. And while they're in the process, we can't expose them unnecessarily to getting sick. Second, this is not a matter just of reducing deaths. And I think this is an important point. We have reduced dramatically the number of people who are losing their lives in COVID, and we should celebrate that. Each one of those lives saved is a miracle in my book. But it's not just lives lost, it's the ability to have a functioning hospital system. We've seen from Michigan to India to other places, to New York to California, when the hospital systems have been overwhelmed and people can't get elective surgery, can't get ordinary medical care. We all have an interest in keeping this pandemic at bay while this vaccine effort is underway. Now, as folks know, we are going to be looking at the metrics of our counties. We will have announcements about where they are on Tuesday. That will be determined by the metrics of the virus. We do that every 3 weeks. And we'd like to say that this is resolved and no one ever has anything to worry about. That is not the case, unfortunately, because quite a number of counties have had their numbers gone up quite significantly. So we'll have more to talk about on Tuesday in that regard. I wanted to again show our vaccine locator. If we can put that up on the screen. Is that up on the screen yet there? Okay, we got our vaccine locator. We do want folks to continue this effort. We are trying to make the vaccine, thank you, that's good enough. We do want to make the vaccine as accessible to everyone as we can. I was really pleased to be in Ellensburg a couple days ago on the central campus where they were doing about 200 people a day. I think a good number of them are students. And we're seeing very innovative ways all over the state to make the vaccine as accessible as humanly possible. In churches and community centers, we're pleased to say increasing efforts to actually take the vaccine out to people where they live, particularly those who are homebound. That is an increasing effort going on in the state of Washington. We're pleased to say to do that. Now, I do also want to say that it's well known that we have had a slowdown in the demand for the vaccine. Now, this is very concerning because now it is, a terrible thing to think that we would have vaccine to save people's lives and not see it in people's arms. Seeing vaccine on the shelf that can save people's lives is just such a terrible event. I hate to even think about that. But we have seen a slowdown in uptake. And as a result, some counties are not ordering the vaccine because they haven't had enough people to actually want to take them. So there is going to be some change by necessity of the distribution of the vaccine. It will no longer be quite as pro rata to the population of counties because we are seeing different demands rates from counties based on whatever reason in their county. And obviously we can't send vaccines to counties and have them just sit on a shelf. So you will see some changes in the per capita distribution, which is necessitated by the fact that we're seeing different levels of demand from one county to another. This is only common sense. It's necessary. We're not going to allow wasted vaccines. Now, here's another thing I hope people think about on their individual decision on vaccines. It's a great thing that vaccines can save your life. It's a great thing they can keep you from having long-term COVID, long-term symptoms. It's a great thing you can save your family's life. It's a great thing that you can be responsible, a member of our community. But there will be increasing things that vaccine will also give you benefits that you otherwise not be able to enjoy. For instance, we are now going to have new guidelines for cruise ships. And on the Columbia River and out of the Port of Seattle, these new guidelines will allow cruises to take place where everybody's vaccinated on the ship, except those who can't get vaccinated for one reason or another. This is going to go into effect in mid-May. Small example of the benefits of getting vaccinated. We also will be announcing new guidelines that will allow spectator events in sports, performing arts, school graduations, to be able to be with other folks who are vaccinated. Another benefit of getting vaccinated. We'll announce those shortly. So if you want to be with a group of people at the Mariners games, you're going to be able to do that, whereas if you're not vaccinated, you won't be able to do that. Same thing with performing arts and school graduation. Ability to have school graduations will be much more flexible to allow people to have those graduation ceremonies. There will also be changes for religious organizations to those rules. So the same thing, your church will be able to have people who are vaccinated in an area where you're close to your congregants. If you want to go to college, it will be a benefit to be vaccinated. We know Washington State has made a decision and several other of their private colleges. We anticipate more colleges will make announcements in that regard, and I am supportive of those efforts. We simply can't have these outbreaks that not only injure students, and again, this is becoming a much more dangerous situation for people under the age of 40, but these outbreaks threaten the whole town. And we can't have outbreaks on college campuses threatening Pullman and Ellensburg and Bellingham and points east and west. So I applaud Washington State University's decision. The Cougars have led the way in this decision. A big thank to Washington State President Kirk Schultz for his leadership on this. It does take leadership to fight pandemics sometimes, and I appreciate his leadership in the Washington State Cougar community. Seattle University and Pacific Lutheran University also have plans that are similar as well. I applaud their leadership. So, Dr. Shaw, I would defer to you if you had some comments that you'd like to make before we take questions. If Dr. Shaw is there.
Except I'm upside down, so I apologize. I was trying to figure out how to get my camera right side up before I unmuted. Thanks, Governor. Let me start by congratulating Cheryl Strange on her appointment. in my time here in Washington, she's been trusted and respected, and she's a leader in state government. So Governor Inslee, you made the great choice, and we look forward to working with her in her new role. As far as ending this pandemic goes, we all know what we need or should need to do or should do or can do. It's about prevention, absolutely. It's about all those measures, but it's also about vaccinations. And if anyone in Washington, in our state, who is eligible to get vaccinated has not, this is the time. Please do so. You know, we've been saying don't hesitate, vaccinate. If you have been vaccinated, absolutely thank you. But we also want to say now it's your turn to help someone else get their vaccine. And we really want you to encourage those around you, your friends, your family, your coworkers, just to share your experience and to get them also to get vaccinated. So many Washingtonians, 30% of our state, have been fully vaccinated. We've now administered over 5.2 million doses. And that's absolutely incredible progress. But we know we have a lot more work to do. As the governor pointed out, if you're not vaccinated, you are still at risk for this virus. And so the governor and I have talked about it, why take that risk? It's just not worth it. And you know, what we're, seeing in Ferry County concerns us. Not only do you protect yourself if you get vaccinated, but you're protecting each other. Equally importantly, getting vaccinated means that we're getting back to some sense of normalcy. Getting outside without masks was just the beginning, and we really want to just emphasize to people why it's so important to get vaccinated. On our end, let me say we're continuing to focus, as the governor said, on increasing our distribution of vaccine across the state. We want to make vaccine choice the easy choice, that we're removing any of the barriers like limited hours or transportation or misinformation, so we can build the confidence in these miracles of American ingenuity. And we also are equally focused on equity, and we want to encourage that throughout our state. We're now in the fourth wave, and so the governor has said we want to have people protect themselves, protect their family, their friends, and ultimately their community. And we're seeing what's happening across the country and the world, including our thoughts and prayers that go out to those in India and elsewhere who have been impacted. But the reminder is that here close to home, please remember to practice safe behaviors for the upcoming events. Cinco de Mayo is coming up next week. We have Mother's Day coming up, graduations, Memorial Day weekend, Father's Day. We know being outdoors is better than indoors, and we know crowds raise risk, especially if you are not protecting yourself, and especially if you're not vaccinated. Vaccines are the pathway out of this pandemic, Governor, as you say, so let's continue to work together in that direction. Thank you.
Great, thanks, Dr. Shaw. Thank your whole team. They've been working real hard recently, and we appreciate that.
Thank you.
Lacey, did you want to add anything? I don't hear Lacey yet.
We can go to questions.
Oh, good. Thanks, Lacey. Okay, your questions, please. You may fire when ready, Gridley.
First, we've got Rachel LaCourte with AP. Go ahead, Rachel.
Hi, for either Dr. Shaw or Lacey. Given the slowdown in the demand for vaccines, do you have any numbers on how much of the vaccine supply is currently in the state and unused? And then also, knowing that things can change between now and Tuesday, can you give us a bit of an overview of where counties stand now based on these hospitalization and case numbers? Are any of them at risk at going all the way back to phase 1? Are there any counties that may actually move back into phase 3 if current numbers stand?
Yeah, thanks for that question. I'll just say something quickly and then turn it over to Lacey. As far as our percentage goes, that we're still holding steady in that 80-some% of the vaccines that are in the state of Washington that are being administered. So we're still at that level. I think what the governor and all of us are concerned about is what's the road ahead as we start to see individuals who are, for whatever reason, holding off right now or hesitating, and that's where we're really focused on. Lacey, did you want to talk about anything else related to the numbers? On
the questions about roadmap, there are, really a dozen or so counties that are on the border or exceeding the metrics to move to phase 2 or stay in phase 2. There are even some that are close to phase 1. Certainly our hope is that as few move back as possible. We really want to be on a forward path. We want to turn the corner on this fourth surge. And that's going to take using every tool in our toolbox, coming together across the state. So, wearing masks, watching our distance, keeping our social circle small, taking it outside, and stepping forward to get vaccinated, or helping someone from your community get vaccinated.
I would just point out again, this is under our control. We are simply not helpless here. Obviously, it is most disturbing for anyone to have to go backward in this after all we have gone through. We have victory within sight with this vaccine. As the weeks go by and we have hundreds of thousands of more people vaccinated, we're getting close to the goal line. And we have the control in our ability to do that by simply getting vaccinated and wearing masks in the interim while we are. So we hope people will see this as a renewal of our commitment rather than just giving up. Because giving up means no hospitals working eventually. And that's just not acceptable in our state. So we look forward to people continuing on this effort.
Up next, we'll go to Laurel Dunkovich with the spokesman review. Go ahead, Laurel.
Hi, Governor. I have 2 questions for either you or Dr. Shaw. The first one, you mentioned that allocation won't necessarily be pro rata anymore. Can you explain exactly what you'll be looking at? Is that open appointments, wasted dosage? Just a little bit more explanation there. And then secondly, is there any sense, are we getting to a point where rather than vaccine hesitancy, it's more of a vaccine laziness, for lack of a better word, issue where people just don't want to take the time out of the day to get the shot and plan a day to be sick if they get side effects? And I guess what are your plans to maybe deal with that and combat that?
I'll do the second one, and then I'll allow Lacey on the first one. There's a variety, obviously we're all different, there's just a variety of people's perceptions here. Some folks just kind of haven't gotten around to it. We understand that, that's human nature. They might be waiting where, it's not as hard to get an appointment. And we think those folks are going to come in the next several weeks. We think that's great. And we think the easier we make it for them, the more that category of folks are going to get in as early as humanly possible. And we think we're going to succeed in that regard. Then there are some folks who are looking at conspiracy theories and false information that unfortunately get spread on social networks. And it's really unfortunate that people are exposed to this. So we're doing all we can to give people the factual information about the science, that giant majorities of physicians are taking this vaccine. It's been proven safe time after time after time. We've had tens of millions of people, hundreds of millions of people now vaccinated with these vaccines with tremendous results, both to reduce the disease. You're almost 10 times more likely to get it if you haven't been vaccinated. We showed that the other day, Dr. Shaw talked about. So just sharing that information with that group of folks through every means possible, and we have a very extensive advertising effort to share that information with people. We think over time, people will become more willing to and eager to get the vaccine, particularly as they've seen their friends and their neighbors get the vaccine and they remain healthy and they don't grow elk horns on their head. So we think that group of people are going to come in and we want to help them get the right information. There's another group of folks who are just, concerned that somehow this was an intrusion. They've been upset that they have felt that their liberty was intruded upon. And the best answer to that was a PSA I saw was done by a group of Republican congressmen who were physicians. And the argument they made was, look, if you want to get rid of masks, if you want to have total individual liberty and not have any government intrusion in your lives, there is a really strong weapon to do that, and that's to get a vaccine. Because the more people get a vaccine, the more these restrictions can be lifted. So we think that will, over time, increase more people coming in. So long and the short of it, we remain confident that this is going to succeed, but we'd rather succeed earlier rather than later, and that's why we're urging people to help out here. And let's see, do you want to talk about the pro rata issue, Lacey or Dr. Shaw?
Sure. So we have been allocating, as you know, based on primarily on pro rata for the first several months, and that has served us well. I say primarily because we've always considered other factors in our allocation process, including getting enough doses to people who live in socially vulnerable index communities, and making sure that we're allocating doses to providers that are meeting our policies and procedures. So we will continue those factors as well. What is changing now is that we're going to be driven primarily by provider-based ordering. We still will be making sure that there's access to vaccines all across the geography of Washington and working closely with our partners in local health jurisdictions to prioritize their orders. But we will be doing this more demand-based system and making sure that vaccines get to communities where they're needed and where they're going to be used in the next week or so.
Governor, the only thing I would just add is that, we've said throughout that our commitment is to assure that where people, no matter where people live or who they are, that they have access to vaccines. And that's the commitment that we're going to continue to have as we make this pivot. We are still committed to making sure that there's vaccines throughout our communities, but really recognizing the importance of where there's more demand than other places across the state.
Next, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
First question is why Tuesday instead of Monday for the evaluation? And then for the April 12th evaluation, data was used that was current through, I think, April 2nd for case rates and March 30th for hospitalization rates. Do you know the date ranges for what the most recent complete data will be, which you'll use in your evaluation Tuesday?
Dr. Shaw, do you want to answer those?
Yeah, on the evaluation date, Lacey, let me turn that one to you. But what I will say is the reason that we moved to Tuesday versus Monday was we actually wanted to have the latest data that we could use to make our decisions on the metrics. And so we felt that if we were getting that information Friday over the weekend, that announcing it on Monday was still not going to have enough of the latest information. So we want to have the latest information to make these very important decisions because, communities are relying on this. And so we want to be as accurate as well as timely with the information. So Monday, what this allows us to do is to get the information, analyze it on Monday, and then be able to announce where things stand with counties on Tuesday. So again, it's just in the interest of having the latest timely data to make those decisions. And Lacey, did you want to talk about the time frame in terms of,
Yes, the date ranges for the case metrics for complete data will be April 11th through April 24th. For hospitalizations, April 15th through April 21st. And for ICU occupancy, April 19th through April 25th.
Up next, we'll go to Jessamine McIntyre with Q13. Go ahead, Jessamine.
Thank you very much. I think this question could apply to all of you. We're looking at case rates across the country dropping, which is great news, but Washington is among the 17 states in which they're actually rising. Wondering why you think that's so.
I will offer my thinking and then ask Dr. Shaw. There may be several reasons, but amongst them, I'll mention some of them. Number one, we may be a victim of our own success. And what I mean by that is that we have been very, very successful keeping our numbers down, saving people's lives, reducing transmission rates, doing the responsible things that have prevented people from getting sick. But as a result, we have a way lesser percentage of our population that is already immune. So other states like Texas and Florida that had runaway growth in this had horrific experience with horrific deaths in their hospitals. they got maybe 2 or 3 times more people exposed to the virus and sick that became immune. So it seems like karma hasn't really worked very well here, that because we've been very successful, we have a lot more people who do not have immunity today through the natural process. That's a significant reason. But the second reason is there's probably a lot of things we don't understand about temperature and humidity and the actions of this virus. It is still unknown. It appears sometimes unpredictable. But whatever the reason is, what we do know for sure is that we have the tools at our disposal to beat this virus down. And that's why we are encouraging people to use those situations for whatever the reason. Dr. Shaw, do you want to talk more about that from an expert standpoint?
Yeah, Governor, to be honest, I think you hit on both points. Coming from Texas, I can vouch for the fact that in 2020, it was very difficult. We saw communities, and, the one that comes to mind was El Paso, where, frankly, we had hospital systems that were overwhelmed and mobile morgues that were put in place and all sorts of other challenges. And I don't think it's fair necessarily to do comparisons across states when it comes to this, but the governor is right that, when you have the part he didn't highlight, but I will highlight, is that when you do have this differential approach to how you take on COVID-19 and this pandemic, we have saved lives in the state of Washington, and the numbers have shown that. And so I do believe we've done the right thing to save lives, and so perhaps the victim of our success is one way of putting it, but the other is to focus on we have done the right thing by saving lives. Unfortunately, that means that we have to rely more on vaccinations. And that is why it's so critical for us to continue to encourage and do everything we can to remove any barriers for people to get vaccinated. It is really going to be up to us. We do know that there are factors, as the governor mentioned, and we don't understand all of those factors, and this is evolving science that we're going to learn more and more about. But again, just the reminder is that while at the same time we may be seeing some of that increase now, we are at the same time confident that we have saved lives throughout this pandemic, and the data has shown that. So I wanted to make sure to emphasize that, Governor, but otherwise I think you're spot on.
Yeah, I want to just put a parameter on that. This isn't 1 or 2 people. Comparing our state, I think it was New Jersey. If you compare our state to New Jersey, if we had the same death rate that they had, we would have suffered, I think it's 15,000 to 17,000 more loss of lives in the state of Washington. Think of a football stadium with 15,000 to 17,000 people full of our neighbors that we would have lost, who are alive today because of what we did. I got no doubt that we did the right thing as a group, and I credit Washingtonians for this, to save people's lives in our state. Now, as a result of that, we have Texas, maybe in Florida, that have maybe 3 times a higher percentage of people who have natural immunity today. But I wouldn't I would not trade our position with them with all their tens of thousands of lives they lost for a heartbeat.
Any more questions? Okay. Next, we'll go to Keith Eldridge with Comment 4. Go ahead, Keith.
Governor, you're using cases and hospitalizations right now for your metrics. What of the consideration of using vaccinations as one of the metrics and encourage counties to get vaccinated to be able to open up?
Well, it's a possibility. We've given thought to this. I do think that in the next several weeks, you will see increasing policies by the state and other entities like colleges and cruise lines and everything else that will create more incentives for folks. So that is a possibility going forward. To date, we thought that it's more important to focus on the immediate need to keep down people out of hospitals at the moment. But, we haven't ruled out at some point using that, because at some point we have to get to a percentage of the population that has immunity, both vaccine and natural, to break the chain of this pandemic. We do not want to be in a permanent condition in this. We do not want to have to wear masks forever, and we have the capability of not doing that if we'll just go get vaccinated. So stay tuned.
One last question. We'll go to Drew Mickelson with King 5 News. Go ahead, Drew.
That same topic, with potentially dozens of counties moving backwards and the concern that that will cause, has there been any discussion, and maybe even coming up to this weekend, to change the rules? We've changed those before. Do you see that happening, or are we going to stick with the metrics as they are as of today?
No, we are, look, we look at this every day, and we are open to new ideas and new science and every day. So we're always going to be willing to look at the new science. But there's nothing in the new science in the last 2 or 3 weeks that has suggested that this is less of a problem than it was 3 weeks ago. It is more of a problem, demonstrably, in the last 3 weeks. This is a scientific verity. And so we are listening to new information, but it all suggests that A, we're not out of the woods yet, B, it's going to get a lot worse, C, it could overwhelm our hospital situation unless something changes, and D, we know there's things we can do to stop that horrendous occasions from overwhelming our state. And that means to make some, we hope, short-term changes to some of our lives, which is very difficult to people and very difficult for business owners. That's why I'm glad that we've put in hundreds of millions of dollars in the last legislative session to give relief to some of these hard-hit business owners in this regard. So at the moment, there is not serious consideration for changing these metrics.
Any closing remarks?
Just to really hope people can save themselves and their families. And I hope people are successful talking to their loved ones. We all are leaders on this, not just governors and presidents on this. And I'm hoping that nephews can talk to their uncles and employees can talk to their managers and neighbors talk to their neighbors and both share the science of this, that these vaccines are safe, but also share the viewpoint that this is the way that all of us can enjoy our lives that are normal again and have total liberty of all the freedoms that we'd like to have. So there ought to be a reason that appeals to everyone, and I encourage folks to have those conversations. If we do this, I am confident we're going to get through this. I'd like it to be earlier rather than later. So thanks a million. Go Mariners.